Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor of the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. Millions of Americans live with sleep apnea, and many of them may not realize it, and I was one of those. Once diagnosed, many patients end up with a prescription for a CPAP machine. Today, we're going to share new research proving why patients need to adhere to those prescriptions. In short, CPAP can save your life. In studio with me today is Assistant Professor of Medical Informatics, Dr. Diego Mizzachi, who led a study which had a sampling of nearly 900,000 people. I just want to tell you, that's a lot of folks right there. You know how much that excites me to have a really good sample size and research? That's awesome. We're going to hear more details about that in a moment. Also with us, but not yet, stuck in traffic, probably overslept, is sleep medicine specialist Saurav Luthra, who often prescribes CPAP machines for his patients. For all the reasons you're going to learn as we dive into that study. And just to be clear, we also have another guest on this, one of the patients, Joseph Smith. And that's a name I can say. Thank you all for being here. But I want to introduce one more part of our show, my own personal CPAP machine, which I wear every night. And it's awesome. And when I travel, I take this little bugger with me because it could do almost all the same stuff as this big one. We're going to talk a little bit more about the difference between my home machine and my travel machine in just a little bit. Before we jump into our discussion, though, Dr. Dana Hawkins and I have some business to attend to. We've been talking about getting our shots, and then we were going to get them on the air. Well, Dana and I are both getting COVID and flu shots simultaneously right now. And you say, well, why did you wait so long? Well, I had COVID in June, so I had to wait my 3 months plus to make sure I was over that before I got my COVID vaccine. And I wanted to do both COVID and influenza today. And Hawkeye, I think you just wanted to wait. You were like I want to be thoughtful about when I get them relative when the COVID and flu cycles are.
Yeah, certainly for me, it wasn't a big issue with having COVID and then waiting 3 months to get the boost, the updated vaccine. It was more about the influenza vaccine. We certainly never want to miss an opportunity to vaccinate, but if you can, it is probably best to wait until that late October, really to mid-November period for influenza vaccines so that you have adequate optimal immunity through the whole of influenza season, which can go through March or April, because the best immunity for the influenza vaccine typically only lasts about 6 months. So we want to make sure we have that span of the optimal immunity for that time. So we did take the conscious effort to wait and delay the influenza vaccine until now.
And I just want to point out that if I'd done as many bicep curls this morning, or frankly about 2,000 mornings in a row, my arms could look like Hawkeye's. They do not, but I'm here in my KU Jayhawk shirt. So how about
Rock
that?
Chalk.
Rock Chalk Jayhawk. All right, so we're going to go ahead and get these shots. Now, the CDC is recommending a second dose of the COVID shot for people 65 and over. But we're going to talk more about that in just a moment. But first, it's time to get our shot. Let me introduce Grant and Stacy, who are going to help us do just that. All right, Stacy, you got stuck with this bicep.
Whichever
and
is
look,
easier for
I'm
you.
going to do the
I'll
Travis
use them both.
Kelce technique. 2 shots, 1 arm. Travis Kelce, right here, brother. How about you?
Remarkably similar. Yeah, I think we'll do both in one
I have
arm.
the same physique as Travis. Yeah. You know, and Taylor and I are just best buds. You know
Just
what I'm
friends.
saying? It's
That's
just
right.
awesome. Yeah. Oh boy, I felt it, but it's not terrible. Like a little bee sting. Actually, not even bad. It's a bee sting. It's not bad.
And I would say that last week,
my Band-Aids?
I was able to get my updated Tdap, which is tetanus, but also has a component of pertussis in it. And that is very important because right now, many adults do not have immunity to pertussis, and so they end up getting it and then passing it on to the children who may not be vaccinated at that point in time. So it is important to stay up to date with all of the recommended vaccines. Tetanus, Tdap is one of them, and we may hear about another one here coming up as well.
And can I just show my cool arm? Just like Travis Kelce, baby. All right. Look at that. Whoa, watch that script. I'm ready to go catch some footballs. All right, the CDC is recommending a second dose of the COVID shot for people who are age 65 and over and those who are immunocompromised. That should happen about 6 months after the first dose. Hawk, I'm within about 90 days of being in that category. What's going to happen then? Should I get a shot 2 shots a year if I'm over 65?
I would certainly recommend that at this point in time, yeah. Again, they have had previous recommendations, the CDC and ACIP have had previous recommendations for getting a second dose for especially those that are immune compromised or have higher risk factors, and also including age. Sometimes it has ranged from 2 months after that last dose to 4 months after the last dose. This current recommendation is for 6 months after the last dose. And this is to continue to provide optimal immunity to help protect from hospitalization and severe disease. Why is that? Because we know there are different variants that circulate, and there typically probably is not going to be one viral season for COVID, but instead probably what we are going to see is this dance of maybe 3 to 4 cycles a year of increasing viral circulation due to a new variant, going down after that peak to a dip where I think we are right now. And in fact, in the hospital we have only 10 patients compared to 20 and 30 and 40 from earlier in the summer. So I think we are going to see those peaks and valleys of viral circulation throughout the year, maybe 3 to 4 times a year. So I think it will be important to heed that advice if you are at higher risk of severe disease and hospitalization.
And you don't want to get fluvid, so you don't want that combination of influenza and COVID.
No.
We know that people get really sick like that. And new this year, the CDC has lowered the recommended age for pneumococcal vaccines. Now, this is a vaccine that's really important because it protects us against pneumococcal pneumonia, which is a type of bacteria. It used to be 65 and up, now it's 50 and up. Thoughts?
Yeah, I think it is a good recommendation. It is a very safe vaccine. It is just a piece of the bacteria, so you are not getting the infection from the bacteria. It does help protect against pneumonia from pneumococcus or strep pneumoniae, but more importantly, it also protects against invasive disease. And what is that? That means you have bacteremia, where the bacteria can go through your bloodstream, or you can get meningitis from the bacteria as well, or even heart infection with endocarditis. And the vaccine does a very good job of protecting against those complications.
So, Doc Hawk, we're going to check in later a little bit bird flu case here in Missouri. And also, just to mention, New York Times front page this morning was talking about the rise in mycoplasma pneumonia, sometimes called walking pneumonia, especially in those 2 to 4 years of age. Something for our parents to keep track of out there. All right, turning back to CPAP, continuous positive airway pressure. We're going to talk about why that works. But first, Joseph, you use a CPAP machine for sleep apnea. Can I just say it right? This is my CPAP machine at home. This is what I put on every night when I'm at home. Well, I don't really put this on, but it puts pressure in through a hose. This is actually the one to my portable one. But look at this. I just put it on over my face, hook it up. There I go. And I am going to be good to go all night long, and it's awesome. And then when I travel, I use this portable one because it's so small, it fits into a backpack. It's a little bit louder, not loud at all, however, and doesn't have this humidifier, and this makes it easier on my sinuses. This thing is quiet as a mouse, if anybody worried about that. And I'm just here to tell you, it makes all the difference in the world in a good night's sleep. Joseph, let's talk about what symptoms you had for your sleep apnea.
Absolutely. So about a year ago, I switched from night shift to day shift. So at first, I kind of attributed some of that sleepiness to, well, I'm changing shifts and my sleep schedule, changed. But as time went on, I noticed something was a little off. I was way too tired for being 26. And so I went to my primary care physician, and we did all of the checks that you would normally do. So we did a general bill of health, blood work, everything kind of came back normal, and then that's when I was referred to Dr. Luther's team. So we went through a series of sleep studies and nap studies, and eventually we came to the conclusion that I had CPAP. But realistically, I was just waking up. Even after getting 8 hours of sleep, I was waking up so tired. So,
that fatigue thing, that's a big darn deal. Now, did anybody ever tell you you could snore and bring a house down?
Yeah, well, the thing was I didn't have a whole lot of snoring symptoms.
Okay.
So, every once in a while, like if my sinuses were really bad, I would snore. But one of the things that we noticed was I wasn't really snoring, but I did stop breathing when I was sleeping. And the CPAP machine really helped with that quite a bit.
My wife took a video of me to convince me that I had sleep apnea one time, and I was just kind of in a chair, and I'd fallen asleep taking a nap, and I had the sleep apnea fits where you go like that, and you pop awake, and I clearly had it. It was pretty severe. I got the sleep study. Yeah, it was not subtle. Moderately severe oxygen desaturation. All those things can really cause trouble for our lives, right? We're going to talk more about that in just a moment. Now, you were prescribed CPAP therapy too, so I guess you probably have one of these great machines at your house as well.
I do. I think I have the newer model than yours, though, because it's a little bit slimmer.
Cooler,
yeah, a little bit cooler. Yeah.
Okay.
But I agree with you. I mean, it is so quiet. It doesn't beep in the middle of the night. I mean, the quality of life and the quality of sleep. The machine is virtually non-existent in the bedroom. I mean, I don't even notice that it's there 90% of the time. But yeah, the humidifier absolutely helps quite a bit. I noticed my sinuses got a little bit better over time as well, which was an odd side effect.
You're cool. You've got a two-tone machine. I'm talking to my sleep doctor about what, because my machine doesn't look as cool as that one.
Sense 11.
Yeah. And so, any hesitation about wearing your machine?
At first, there's always that initial hesitation. Well, you know, it's bulky, it's awkward, and realistically, I had the 2 nasal pillows that it was so comfortable initially at first that I was a little bit confused. Because over time, you hear all these horror stories about people wearing their CPAP and not being able to sleep at night, and I just didn't have any of that experience. I mean, those nasal pillows are just so comfortable and so non-intrusive that it was a pretty seamless transition.
Well, once you get used to it, it's kind of like, no, I want to put my CPAP on. I sleep better, and I feel better, and in my case, older man, I don't have to get up at night and go to the bathroom quite so often, because otherwise I have to get up at night and pee 3 or 4 times. Well, that's no fun at all. That kind of hurts your sleep. Yeah. And so that's made a big difference for me as well. So. Now, some people think people hate the CPAP because of the noise.
I've never noticed any noise with it. I mean, like you said, with the travel one, maybe it's a little bit louder. But for the one that I keep on my nightstand, there's no noise coming out of it.
Here's what I promise you. My wife would say that there is no comparison in the amount of noise between either of these machines, that or the little travel booger here, and how loud I snore. No comparison whatsoever. So have you heard that same comment? Now, you say you don't snore as much, but you just sleep so much more comfortably.
Yes, I toss and turn a lot less. So I'm not moving around as a lot, not doing a lot of the aerobatics and, you know, in the middle of the night and jerking awake. That's, seriously, I mean, it's
true.
Yeah, I think quality of sleep-wise, it's much better nowadays.
And you feel better during the day.
Oh, absolutely. It was a night and day difference for me personally.
Yeah.
You know.
I remember seeing a patient one time, and he was a school bus driver and was falling asleep but driving a school bus, and his wife had brought him down. And we had done a sleep test on him that night, and he'd worn it for about 4 hours. And she called back and she said, "Oh my God, I have my husband back. I want the machine. How fast can we get that machine just from having it on for 4 hours?" So obstructive sleep apnea is a type of issue where, like our patient has just shared, your airway closes while you sleep. Now, your body, when your airway closes down, you can't get air in very well, and it leads to a whole host of downstream problems: fatigue, headaches, heart arrhythmias, and other types of heart problems. Dr. Luther has joined us. We made fun of you for not being here. We said you overslept or something. They were sleeping. Wow, that was a bad joke. Okay, so what are some of the more common downstream problems that patients see?
Yeah, first of all, thank you for coming here and sharing your experience, and I'm glad you're doing great. So sleep apnea, I tell patients, think of this as a chronic health condition just like diabetes is. It has cardiovascular effects where it can affect your blood pressure, heart rate, can lead to arrhythmias like atrial fibrillation, and that can lead to stroke even. It has a metabolic impact on your body, so it can increase insulin resistance that we now know is then the cause for obesity, diabetes, etc. It also affects your neurocognitive function. So your memory, your mood, and your processing of tasks, organizing thoughts is all related to how deep you slept and how uninterrupted you slept. So, you know, it has an impact on quality of life because of that. It increases your energy levels and your productivity, if you are thinking about that. So it has a whole plethora of effects where when we treat somebody, I tell them, you know, think of treating sleep apnea as increasing your health span. We're not just treating you acutely for your symptoms and just reducing your snoring. We are increasing your health span by preventing these chronic health conditions from getting to you.
Yeah, I mean, that heart attack or stroke thing, especially the older you get, the more at risk I think you can be. And,
yes.
And so this can be really severe to people. And I think it's probably underappreciated the degree of severity patients can have.
Yeah.
So Dr. Mazzocchi, first, congratulations, your study being published in JAMA. That's
Thank
a
you.
big darn deal.
Thank you.
Now, I've got a whole bunch of questions, but first, let's tackle a couple of the housekeeping notes. Explain what the heck does a medical informatics person do, right? Or doctor do, right?
I'm a medical informatics assistant professor, and one of the things that medical informaticists do is really try to gather all this clinical data that's been collected over the several years across many patients in a health system like ours, and even across the United States, organize this data very well, and then start asking questions that we really want to know. Like, for example, the question that we addressed in the study. Well, does CPAP help reduce someone's risk of mortality or someone's risk of having cardiovascular diseases? And that's how we can get to those sample sizes of 900,000 patients, because there's a lot of people that help organize this data in a way that makes it easier for folks to analyze them together, and that's what we did in this study.
Yeah, that's pretty remarkable. Now, your study, 900,000 patients. Now, tell us a little bit about the methodology and how you got such a really large sample size, because that's impressive.
Yes, it is. So this study is all retrospective. So in other words, we look back at data that has already been collected. So we're doing this as part of this network that's called Greater Plains Collaborative. And that network is actually currently led by our colleagues across the state line at the University of Missouri. And we are actually looking at claims data from Medicare patients. So in this study, we only looked at older adults, 65 and older, that were Medicare beneficiaries. And then we look at how many claims of CPAP they got. So all of them had sleep apnea. And across all the participants in the study, we classified them as having started CPAP-based claim or not starting CPAP based on this claim. So then we compared those individuals for over 5 years and determined to see which group had the highest risk of dying or the highest risk of developing a cardiovascular event over this 5 years. And that's how we compared those results, and then found that those that started CPAP had evidence that they started CPAP. They have much lower risk of mortality and cardiovascular diseases.
That is really impressive. Yeah, and so Tiger's working with Jayhawks, also always cool.
Yeah.
This being a Mizzou grad and a KU guy now. So the study showed impressive data for people who appear to use their CPAP, with perhaps the strongest benefit being protection against having a heart attack. And first of all, what other health benefits did you find while you're looking through that information? But also, what was the risk reduction for having a heart attack?
Yeah, so the risk reduction was about 20%, which was
pretty big, substantial.
Yes, it's corresponding to some medications that we see right there that are used to prevent some of those conditions. So yeah, so other data that we looked at was other cardiovascular diseases like heart failure, which had a positive impact as well, stroke, which also had a positive impact. But I think the greatest benefit was really on all-cause mortality, because that was almost like a 50% reduction based on this study. So that's very, very large, particularly for this.
50% reduction in all-cause mortality?
Yes.
Holy cow.
And you're talking about older adults, 65 and older, so they are at higher risk of mortality. But yeah.
So CPAP's going to help me live longer.
Yeah. Yeah.
Well, that's awesome. I'll take all the help I can get. Now, your study also showed that women get more benefit from wearing CPAP. Now, not trying to be gender biased here, but is that because they actually wear it compared to guys, and guys sometimes resist wearing it?
Yeah, so this is probably one of the things that we need to consider when doing those large-scale studies, because differently from a randomized clinical trial where we actually randomize patients to start therapy versus not, we only look back at patients that used CPAP or didn't use CPAP. We didn't really know what are the factors that drove them to start using their CPAP. Maybe they had a doctor, they have a doctor like Dr. Lutra that simulates the patient to wear their CPAP. Now we do see that sometimes women follow along with some medical restrictions more often than men, and perhaps they were just living a healthier lifestyle or being more aware of their own health. So therefore, we need to be careful about this sort of bias that sometimes happens in the studies, which it's not might necessarily be the effect of CPAP. It could just be the effect of the healthy lifestyle that is associated with someone that's more likely to wear their CPAP. So that's one of the factors that we found. But we also found that folks that had other comorbidities like obesity or COPD, they also seen better benefits of CPAP in this particular study.
That is remarkable. So, Joseph, what do you think about all this research? And you think it's going to make you want to wear your CPAP more, or are you already inspired enough to wear it?
I've already seen enough of a difference in my day-to-day life and the productivity at work and at home that I'll continue to wear mine, But I know I'm a heavier set guy, so knowing that it could elongate my life for decades even, is enough of a motivating factor for me to continue to wear it.
That's a big deal, you know. So well, when I started as a CPAP, I was a pretty thin guy, but maybe I'm a little older now and don't have the same shapely figure. But you know, I've probably been on it for almost 15 to 20 years, and my biggest fear about bringing my machines in the night is that it means if I leave them here, I can't sleep. I have to come back and get them at 10 or 11 o'clock at night.
Yep.
So, Dr. Luther, what are the barriers to wearing CPAP? What are patients going to complain about the most?
Yeah, so I think the common ones that we hear is discomfort with the equipment, which is actually more before the patients have actually tried the equipment. They would talk about they cannot sleep with a headgear on their hair would get messed up.
I don't have much hair to mess up.
So these Velcro headgears, some of the female patients of mine would complain that their head gets all messed up at nighttime. But I think the equipment discomfort.
Look at that.
Yeah, and now.
You know, it's not bad.
Yeah,
it's
and
really
we
not bad.
have.
I can read and talk, and I look good. I probably look better like this on the show, right? So,
and we have models now which are even much more lighter than these, which just basically have an elastic band going in the back. And it comes here. You don't even have to do any Velcro or magnets. So I think equipment discomfort is one. I also feel that education and motivation is another big one, where a lot of patients come to us who were given a CPAP, but they were not really educated regarding the impacts and the downstream effects of sleep apnea. So they were never really fully motivated to use it, and it requires a degree of motivation. So I think once you educate them about what sleep apnea is and what it is not, then they are more motivated to do that every night.
Yeah, it's impressive. And just to say, you know, Travis is pretty cool. He has the 2 Band-Aids on his arm, but I bet he doesn't have a CPAP with 2 Band-Aids. It's awesome right there. All right, we are here to answer your questions. Send them using the links on your tube, on your screen, to you from YouTube, Facebook, or email the Medical News Network. Let's go check back now with Doc Hawk. Hawk, how's your arm feeling?
It's feeling great.
Yeah.
You know, and I haven't passed out, so I think we're doing well with both shots in the same arm.
Yeah, I think we're going to be good.
Yeah.
All right, let's close the loop on this bird flu case in Missouri.
Yeah.
Serology test results are finally coming back, and kind of as you and I predicted, we're thinking this really wasn't a bunch of bird flu person to person.
Yeah, I think we have to really ask those questions and understand, and it is certainly a concern, and that's why the investigations are done. If you remember, there was a person who was diagnosed with H5N1 influenza. The diagnosis came after they were released from the hospital for probably some other types of symptoms, but there were at least 6, if not 7, healthcare workers around that patient who then developed respiratory symptoms. Again, we are not sure exactly what symptoms the patient had. Most of the H5N1 influenza cases in America, in the U.S., have really presented with mostly conjunctivitis, which is red eyes. So anyways, the patient got discharged home. After the patient was discharged, the diagnosis of H5N1 came back for that patient on routine influenza surveillance. Healthcare workers around that patient before PPE was used did have respiratory symptoms, but really, you know, there were other viruses, most notably, as you said, SARS-CoV-2 was circulating at a high level at that point of time. There was one patient who was tested for influenza at the time of the respiratory symptoms. That influenza testing was negative. They then had to send off serologies or blood to look for antibodies to H5N1. They actually did and made new specific tests so they could make sure that, so the CDC could make sure that they ruled out any other influenza exposure. And what that serology, what those antibodies came back and said was that those healthcare workers that experienced respiratory symptoms were negative. Their body had never actually ever seen the virus, so more than likely they probably had COVID-19 at that point in time. So right now, nothing to suggest easy transmission from human to human of H5N1.
So a lot of kind of to do about nothing right there is kind of what that turns out to be. And you and I were pretty suspicious. Remember when they started describing the case, everybody else around them had symptoms. They must have had bird flu. No, they probably had, to your point, COVID, or they may have rhinovirus. I mean, who knows what they got, right?
Exactly.
So, well, we know many of you have questions. We're going to head now to Studio B with Alexis.
I have a question from Reva Jean. Reva wants to know, when do you get vaccinated if you had COVID this fall?
Oh man, Hawkeye, I think I waited about 3 to 4 months after my COVID exposure to get vaccinated again. What do you think?
Yeah, absolutely. We have been recommending that 3 months, that 90 days. Why is that? Because when you have the infection, you get that natural boost to your immune system, not only against spike, but also other components of the virus. And so we are waiting for that increased immune response 90 days after the infection. As it declines, then you can get your updated vaccine, and that will again give you kind of another very short-lived immune boost or response, especially in your antibody levels. And there is good data to support the fact that 3 to 4 weeks after vaccination, you actually do have a decreased risk of actually getting infected with SARS-CoV-2 as well. So there is that added benefit as well, although again, the main function of the vaccine is to protect you from severe disease and hospitalization.
You know, go ahead, Alexis.
I had another question from Brenda, but did you want to add something to that, Dr. Stites?
I had a question too, but let's get yours first.
Okay, Brenda wants to know if you could just clarify the CDC recommendation for when you should get vaccinated for pneumonia.
So the pneumococcal vaccine, which is directed against strep pneumoniae, which is a very common cause of pneumonia, the recommendation now, it was 65 and older, unless you have other health problems, like all of my HIV patients get vaccinated against it.
Sleep apnea.
What's that?
Sleep apnea.
Sleep apnea. But now the new recommendation, they have lowered that age of 65 down to 50.
Okay, so 50. Yeah, Brenda thought it was 75, but Brenda, it's 50 now.
50,
Kathy
decreased, yeah.
Lipsky Stone wants to know she has a concern because she says a family member wears a CPAP machine and that family member's oxygen level still drops some of the time.
Dr. Luther, thoughts?
So, that is a common issue. Depending upon how severe the sleep apnea was in the beginning, or if they have coexisting pulmonary conditions, we can have a persistent drop in the oxygen even after CPAP use. So CPAP is really opening up your airway, but to what degree you recruit your lung to oxygenate can lead to persistent low oxygen levels, which is also a treatment goal of ours. So when we start somebody on treatment, we also pay attention to make sure that their oxygen has normalized at night. And if it hasn't, then there are measures that can be done. Sometimes that involves increasing their starting pressure. Recruiting more lung tissue at nighttime can help eliminate that, or sometimes it may mean adding some amount of additional oxygen into the machine.
So Kathy has
people who have underlying lung disease may have a little bit of a problem with the low oxygen, in addition to having the sleep apnea. So sometimes you do both, and there's also different modes of this that you can do that help some patients.
Correct.
Yeah.
Kathy has a follow-up. She specifically wants to know what they should do because the oxygen levels are going down to 88 to 87% for 18 minutes or more. So is that not a concern for her, or should she get her loved one in to see a doctor?
I think they should see a doctor. That is definitely in the abnormal range.
Yeah, you don't want to be low oxygen because that's going to hamper your heart and bring back those risks of stroke and heart attack that you've talked about.
Correct.
So there's a lot of reasons to get that followed up.
To some extent, the debate is going on that the degree of hypoxia may actually be more important than the number of events in terms of protecting your heart and your brain.
Yeah, some of us got down to the high 60s on their sleep study. That was probably a little too low.
Jeremy has a question about the CPAP machines and insurance. Jeremy Yenser wants to know if there are any issues with insurance, especially he writes Medicaid, where they might only cover certain types of the CPAP machine, because Jeremy says, I didn't even know about the small nose pillow version.
Right. So typically insurance companies do not dictate what type of mask you get. So when we are talking about nasal pillows, it's just a mask. If the company is approving your treatment, that includes the whole package with the machine and the mask. So I think the problem there is that when you go and pick up this machine, the company there may not have explored all the options with you, but they are covered by your insurance. You can have any type of mask once you get a coverage for your machine from any insurance.
Yeah, and I'll tell you, when you and I both use different masks, I've never tried the nasal pieces. I've always been so comfortable in my little nasal triangle. It's worked great. And I think you just need the one that works for you. And there's so many different ones out there now, we can really kind of fit them for the person.
Krista has a message for Dr. Luthra. Krista writes, Dr. Luthra is great at managing sleep apnea and other sleep disorders. Dr. Luthra has fans out there.
Man, that's pretty good. I don't get any fans like that. I would just tell me to bug off.
I'm sure you do.
Jan has a question about her CPAP. She writes, my CPAP wakes me up when air explodes out of my mouth despite wearing a chin strap. Doesn't happen every night, but it did last night and it keeps me awake. What can I do?
Yeah, I think that problem may happen if somebody is developing what we call complex sleep apnea. So sometimes the patients are on auto CPAP machines, and in the middle of the night they have a central episode where there is no mechanical obstruction. The CPAP ends to blow to the highest setting, and that can lead to leakage even if patient is wearing a chin strap. So for those patients, I recommend that they connect back with us. We will review or download from the machine. If they are having more central episodes, then sometimes adjusting the CPAP setting, sometimes I put them on a fixed pressure instead of an auto machine, can eliminate some of those issues.
So when we say central apnea, there's the ones that come about because our throat's collapsing, and then sometimes our brain doesn't work as well, and they can both cause problems.
Correct.
And we have to address both of those.
Yes, exactly.
Rebecca wants to know if there are any alternatives to sleep apnea treatments that are available that aren't the CPAP machine.
Absolutely. Yeah, we have several alternatives. So depending upon someone's severity of apnea, if they are mild, we also have a mandibular advancement device that I frequently send my patients to get, which is basically sort of like a bite guard. You put it inside the mouth and it adjusts and stabilizes your lower jaw and tongue, and that can improve sleep apnea. If they are more moderate to severe and they are within certain criteria, then we also have an implant at KU now, which is called the hypoglossal nerve stimulator, or Inspire. We've been doing that for a few years now, and that is more invasive than CPAP, but it definitely gets them off the mask and machine, and it is an implant that gets put under the skin, and once they have it, they just have a remote at nighttime. They turn it on. Every time they breathe in, their tongue moves forward with every breath. They don't realize that because it only starts when they are sleeping. So that's another alternative. And then we have medications that are in trials and have shown effect, where we can give them medications at nighttime that increases the tone of their muscles and can also stabilize mild to moderate degrees of sleep apnea.
And just to say, the GLP-1 agonists may have a role, right?
Absolutely,
There's some interesting data coming out now about using those to help reduce weight and help you get off CPAP.
Yes, there was a trial that showed GLP compared with CPAP almost had similar efficacy in controlling apnea.
Yeah, so that's Ozempic and Wegovy and things like that. Man, we could talk about this a lot more, and there's so much stuff to take from your information, from your article. Congratulations again, and from our discussion. But we have to go on. So I want to say a big shout out to everybody for being here on the program today. We're grateful for you guys coming. Thank you. Let's hear some final thoughts before we go. Joseph.
My one takeaway from CPAP machine and getting tested for sleep apnea is that it's not as scary or intrusive as you think it is. That was my biggest concern or hurdle to going and seeing a pulmonologist like Dr. Luthra. I was just scared of it, and realistically there's not a whole lot to be scared of. That fear was kind of unfounded. So definitely, if you're having some problems with the quality of your sleep, definitely go see somebody. It's worth it.
Get it addressed. Dr. Luthra.
Yeah, I think my thoughts are that sleep is, think of sleep as something that improves your health span. Go with that mindset. Sleep disorders do not equal to CPAP, and CPAP do not equal to discomfort. Let's talk about sleep. If you have a sleep issue, bring it up to your doctors, and there's so many things that we can do to improve your sleep, not just from breathing standpoint, but from so many other different angles. Just pay attention to sleep. Healthy sleep is important for a healthy lifespan.
Dr. Mazzacci.
Yeah, and you sleep for about 30 years of your life, if you think about it, right? So I think you might want to consider thinking about how important it is for your life. And then for those that got vaccinated today, I would strongly recommend that you have a great night of sleep, because that's really going to help boost your immune system to develop those antibodies. And for those that haven't get vaccinated yet, make sure that you sleep well the night before as well. So that can also help with
I had a good workout this morning too. So.
Yeah.
Hawk?
No, I think that's a great point. I want to hit on that first. People always ask us, and they have asked us, Steve, what can we do to boost our immune system? We've always talked about good activity, eating nutritionally, getting vaccinated, but also importantly, we've always said get adequate sleep as well. So just want to give another PSA. Please, everybody, Go get vaccinated. Keep up with your vaccines. You know, we are always in a battle with the world around us. You can protect yourself. These vaccines are safe. They are efficacious. They will protect you and your family. We know that there have been more and more exemptions, especially for young kids by their parents to not get vaccinated. In my opinion, that is fully the wrong call. We know vaccines have helped protect children since they have come out, and it's been a number of them, obviously. Measles, mumps, rubella, tetanus, pertussis, all of those vaccines. Please go get vaccinated. And a week from now, we will have the end of election season the next time we meet. So I would encourage everybody to celebrate this week by go getting up to date with your vaccines and getting your vote in on November 5th, or before that if you can early vote, if you haven't already. In fact, maybe even on November 5th, go vote early and then go get your updated COVID vaccine and your influenza vaccine.
Or your pneumococcal.
Or your pneumococcal, absolutely.
So, excellent final thought, Hawkeye. I love that one. Hey, I was going to make this other comment. You know, I grew up as a Mizzou Tiger, M-I-Z-Z-O-U. And I have now said, I can love the Jayhawks, Rock Chalk Jayhawk. I even got my KU shirt on. It is possible to overcome these early or even adult biases and do things that turn out to be a great part of your life. You know what else can be a great part of your life? Taking great care of yourself. Whether it's CPAP, vaccination, exercise, eating well, those things really make a difference. And as Dr. Mazzacci has testified, great data showing how CPAP can help you prolong your life. And I'm going to tell you, it's the best night of sleep I've had. Thanks again to all of our guests and to all of our audience. Remember, faith, hope, and science right here on Open Mics. We'll see you next week.
A single mother of 6 who had no time to slow down is told her heart is failing. I'm Alexis Del Cid. On the next All Things Heart, what doctors did that has her back to living her life and being a mom.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.